Hello. Hi, everyone. Can y'all see me? I'm trying to do this technology thingy. And if you can see me, just say hi. And if you can't, say something because it's telling me to rotate my phone. My brother is on the building. Yay. Hi, Chris. Ellis, hi. Good afternoon, everyone. It's Sunday afternoon, so you know if it's Sunday afternoon, it's time for Ask Dr. Lulu. So I'm trying, excuse me, something new today. My son, the technology whiz, is trying to put me live on my cell phone, my laptop. So I'm supposed to be on Tina Live, my personal page, as well as Ask Dr. Lulu. So hopefully you guys are all seeing me. I see a few people already. Hi, Stephanie. Hi, Cheryl. Hi, Chris, my brother. Hi, Elise. We're going to try to get started. So if you don't know me already, my name is Dr. Lulu. I am the momatrician and teen expert national keynote speaker on depression, suicide, and bullying, especially where children, teenagers, and young adults are concerned. So if you can see me, please holla at your girl and let's get, somebody said rotate your phone. Yeah, thank you for saying that. I'm trying to rotate my phone and hold on. Thank you for saying something. We're trying this thing live. Okay. So bear with me. Let me see. I'm going to try to rotate it. Just give me a minute, okay? And thank you for saying something. Ngozi is in the building. Hey, girl. Okay, my brother says good now. Okay. So if you don't know me already, just know now, me and technology have agreed to disagree. Cheryl says much better. Let me get my son here. Wait. Just bear with me. Uh-oh. Okay. Is that better? Or did the camera turn? Okay, I'm back. All right, just manage, okay? Just manage. So this is my cell phone. I know I'm kind of twisted, but I can't make it straighter without How about leaving good enough alone? Is that okay? Because I don't want it to break. Okay, I'm getting some thumbs up. That's good. So we're going to talk about ADHD today, okay? If you are watching me and you have a family member who's a teenager, a child, a parent, if you've ever wondered if you have ADHD, if you're a grandparent who thinks your grandson might have ADHD, I want you to take a moment, just one single moment, to invite them or tag them or whichever one works better. My brother said, perfect. I guess that's perfect. Okay, so we are going to be talking about something that is near and dear to my heart, which is pediatrics. And this request was from Stephanie Tweedy. Hi, Stephanie. She wanted us to talk about ADHD. So you know how I am. I'm gonna do what you guys asked me to do. So we're talking about ADHD today. Let me see. Shout out to Christina, Safirat, Tasora, Lena, Uzma, and Ellis. Ellis is saying something. Can you hear me, Ellis? She can hear me now. Okay, fantastic. Okay, so let's get started. Sorry about it. This is live. You can never edit live. I love it. So if you've ever wondered to yourself, do you have ADHD? Do I have ADHD? Does my husband have ADHD? Does my little son Pookie have ADHD? What about Peaches? Does she have ADHD? We want to talk about it today. Okay, so first things first. I'm going to start by asking questions. You're welcome to respond if you want to, or just in your little room right there, you can raise up your hand. If I touch a nerve, that'll be good. So first question, do you find it hard to focus on a task? Give me a thumbs up if you find it hard to focus on a task. If you find it hard to pay attention, do you find yourself daydreaming and drifting off when, like my classmate said, during a meeting, during a conference or something? If you find that, give me a holler. Do you find it? Do you find yourself constantly moving from place to place, like can't sit still for nothing? What about those people that always kind of shaking their knee all the time? Are you one of those people? Do you find that you cannot sit still? Do you find yourself unable to complete tasks? Like you start drinking the water, then you stop, and then you start, oh, squirrel, and then you start writing, oh, let me go see about. Are you one of those people, or is your kid one of those people? Okay. Do you find yourself constantly interrupting people, constantly interrupting others? You can't wait your turn for nothing. You want to say something right quick. I gotta say something. Pick me. kind of thing. Do you find that happening? Okay. Are you always on the go? Like you just gotta get it done. You just gotta go. You gotta get this done and that done, and you start this and you don't finish and all of that. Are you disorganized? Are you noisy? Is your kid noisy? Is your kid one of those kids that has a hard time playing quietly? Something like that. Noisy. Do you miss deadlines at work? For the adults who are watching me, do you miss deadlines at work? Are you always getting a note from your boss like, what about this task I asked you to finish last week? And, oh, I forgot. Are you talkative like me? Do you always have to say something? Cheryl says, like driven. Oh, thank you. I look gorgeous, girl. I'm trying to harness my inner Nigerian today. So yeah, Cheryl says, like driven by a motor. Yes. Yes. Sherry says, and yes, she obviously finds it hard to focus on a task. You know, Sherry, we know about that. Yeah, we're going to talk about that. We know about that. Do you miss deadlines? Are you impulsive? Like, you're not thinking before you cross the road. Like, you're just going to do it and then you think about it later on. Are you impulsive? And do you not follow directions, or do you find it hard to follow directions? Let's put it that way. Do you find it difficult to follow directions? Is it hard for you to follow directions? Let me see. My mom is in the building. Hi, Mom. Ngozi, Ann, Auntie Ann. Okay, good. We have a full house. Then, do you avoid tasks that require sustained attention? Like me. If I have to do something that's going to require me to sit still and focus for a while, i.e. trying to finish my book, which I finally finished, by the way, my ebook, do you find it hard to do it? Now, I think what I'll say about that, though, is if I'm doing something that I like, I probably will do it. But are you one of those people that have a hard time just kind of staying on any kind of task that requires a lot of attention? Do you find yourself making careless mistakes? When I was a younger child, I made a lot of careless mistakes. My dad used to say that they were just careless mistakes. You know this thing. You know this thing, and you know it already. Why did you make this mistake? Why did you miss this? Something like that. So my dad was always like on me for making careless mistakes. Are you a daydreamer? You know, I don't think I'm a daydreamer, but do you find yourself daydreaming a lot? That's also another one of the symptoms. So tag yourself. You know yourselves. Tag yourselves. If you have any family members who have these symptoms, tag them. So what are we talking about? We're talking about something called ADHD. The definition is attention deficit hyperactivity disorder. As a pediatrician, I get this a lot. I get a lot of people that think their kids have ADHD. I get a lot of people whose kids have ADHD and are in denial. I get a lot of the combination, and somewhere in between. And no, it's not everything that smells and tastes that is, right? So some things are what we call, I guess, similar. They have kind of similar symptoms, but they are not quite ADHD, and we're going to get to that later on. And then we also have other things called comorbid, which are other things that coexist with ADHD that make you think, yeah, maybe it's ADHD, maybe it's not. So we're going to get to that later. All right, so real quick, some numbers. I know I have Ellis somewhere. Ellis is an Asta to Lulu. Ellis, you want to take some numbers for me? Anybody can take numbers. It doesn't matter. So some of the numbers. Let me just say how is the word common. How common this disorder is extremely common in children as well as in adults. So 6.1 million children. As of 2016, there was a study that was done by the NIH. 6.1 million children have ever been diagnosed with ADHD. 6.1 million children, okay? Of those 6.1 million, about 400,000 of them were aged between 2 and 5, okay? And about 2.4 million of them were aged between 6 and 11. So again, I'm saying these numbers, throwing them out. So if you know your kids, if you know the age of your kids, you can be checking it off mentally or yourself. 3.3 million of these people were adolescents. So yes, teenagers can have it. Adolescents can have it, and we'll get to that later. 4.4% of adults have ADHD. Woo! 4.4. That's a lot of us. Okay, so come out of your woodworks. Stop being in denial. Come out. It's a party. You know what my son did? When we're talking about the adults, he went ahead and did this little list for me. Bless his heart, my little guy. He has a list of 10 stars, 10 famous people who have ADHD. 10, just 10. There are many more. 1, will.i.am. will.i.am has ADHD. Lisa Ling. How about that? Lisa Ling has ADHD. Emma Watson. Emma Watson has ADHD. I know this person is it's not on this list, but I know Will Smith has ADHD. He's not on this list. Simone Biles, yes, definitely. I talked about Simone Biles as a matter of fact. She's very vocal about her ADHD. She talks about taking Adderall all the time. So Simone Biles has ADHD. Howie Mandel, surprise? No. As a matter of fact, Jim Carrey has ADHD, but his name is not on here. And I think I remember they said President Bill Clinton has ADHD. His name is not on here. Terry Bradshaw, I can understand that, has ADHD. Adam Levin, I'm not sure who that is, has ADHD. Justin Bieber, Biebs, has ADHD. Hello, makes sense, right? Timberlake, Justin Timberlake, so two Justins, Justin Timberlake, Justin Bieber, and Michael Phelps. Michael Phelps, he's known for that. He talks about it. But do you see a trend here? All these adults that have ADHD, do you see a trend here? They are famous. And this is just 10 of them. Not even, and this in America, not even anywhere else. 10 adults that you know that are famous, good, high achievers, famous people who, when they put their ADHD to use, they can, that's exactly what I'm talking about. I have ADHD, self-proclaimed, self-diagnosed, not on medication, hoo-hoo. What I'm trying to say is we are creative people. So don't hide with your ADHD. Come out and claim it. These 10 people or 12 or 13 people that I just called have ADHD and they've gone out with their ADHD. They're out with it. They're talking about it. Michael Phelps, Justin Timberlake, Howie Mandel, Justin Bieber, Simone Biles, Terry Bradshaw, Adam Levin, Emma Watson, Lisa Ling, will.i.am. And I'm going to add Will Smith, and I'm going to add President Bill Clinton, and I'm going to add, I forget the name of the comedian who committed suicide recently. He also has ADHD. So a lot of people have ADHD. So the reason I'm saying this is because ADHD is so common and so known. Most of my patients' moms are still struggling with it. Most of my Nigerian friends struggle with the idea that my child might have ADHD. Or, oh my God, I have ADHD. Nobody wants to be labeled. Nobody wants to put a name to it. But I dare to tell you, if you put a name to it, if you claim it, it is the beginning of taking care of it. We got to put a name to something before we got to identify it, i.e. make a diagnosis, right? But if you're going to be hiding that, oh, I don't want people to know that I have ADHD, or whatever, then we're not going to be able to help you, one. Number two, you can't harness all of that goodness that is in there that's just waiting to kind of exhale. So come out and claim it if you have ADHD. If you think Robin Williams, thank you. That's exactly who it is. Robin Williams has ADHD. So yeah, just come out and say it, come out and claim it. And if you have ADHD, why not? You know, just come out and say it. So I thought that was neat. He did that. So thank you, sweetheart. Thank you so much. That's my little man. So now you know you are in good company. You have a lot of friends who have ADHD. You know, just come out and join us. Let's have a big party. So some of the symptoms of ADHD, we already kind of touched on that. For those who are just joining us, talkative, hello. Daydreamers, not me, but a lot of people. And I know Cheryl said, Cheryl is a pediatrician, by the way. Cheryl said, she said something about girls tend to be more daydreamers and boys tend to be more hyperactive. That is true. In the old days, they used to kind of say that, even now. But what we find out that there's a little bit of both. Now we talk about ADHD, predominantly hyperactive type, or ADHD, predominantly inattentive type. I think I probably had all three when I was younger. And actually what they say is as you get older, the impulsivity part, the hyperactive part tends to kind of get better, and then the inattentive part kind of persists. Like, where are my keys? I'm the number one. I'm always looking for my keys. Even though we have a place in our house where we keep the keys, right? I forget, and I don't even put the keys. Oh my God. And then I forget my phone. I never know where my phone is. So, you know, I can't find out, what am I doing here again? What did I come into the room to do? If you have ever felt this or been this, come out and holler at your girl. It's lonely out here, you know? So yes, I'm forgetful. I know that. I'll be the first to say that. I'm talkative. I still am. But you know what I said? I decided that, you know, I'm going to use my talkativeness to do something positive. So I'm going to talk about depression and suicide and bullying in children because, you know, I can. So come out and use the gifts which God has given you. It's okay. Always on the go. Forgetful, careless. I probably lost a lot of stuff when I was young. I remember when I was young, my uncle had gone to America when I was much, much younger. And he bought me a locket a locket that was a beetle. It was a watch locket, and it was a beetle, and the wings will open and it will show the watch. And I kept that watch, and I kept that watch, and I kept that watch. And then one day I took the watch to school, to boarding school. I don't even know if it lasted a week. The watch never came back. So yeah, I lost a lot of things. I probably still lose stuff now. I was like, where did I keep that pen? And I'm just going crazy and go crazy. So yeah, just come out and own it. And like she said, acceptance is key. If you don't come out and say it, you're not gonna, first of all, you're not gonna be able to, we can't help you. Second of all, you're not gonna get better. So come out and say it and then claim it. Oh my God, difficulty falling asleep. And I'm gonna add also staying asleep. I sleep like I guess like a gnat or like a bird. I cannot, if there's one little noise, I'm up. Okay, first of all, I have a hard time falling asleep, so I usually just read myself into the night. And then even when I'm sleeping, if you make a little noise, I'm up. So if you have a hard time falling asleep, difficulty with sleepy, oh my God, that's a big one, okay? So again, come out and claim it, okay? Let me see, not something down. I can't read, maybe not cooling, I don't know what I wrote. I can't even read my own handwriting. Easily interrupting other people, not getting along with others. So in this case, I'm going to say most children who have ADHD actually do stand out, either from their gifts or just because they tend to be a little bit obnoxious, maybe a little more, what they call it, too forward in Nigeria. So you're too forward. This kid, you're too forward. And then they call them stubborn, and then they call them bad, and they call them all the things because they're just not quiet. Well, I'm married to someone who's like this bottle. If you put her here, she's going to stay right there. But that's not who I am, and together we'll blow up, right? So that's good. But I'm not going to become that ever, and she's not going to become me ever. It's just, everyone is so different. So yeah, a lot of the kids who have ADHD tend to kind of stand out and tend to be, I'm going to put in quotes, please, air quotes, obnoxious, because they tend to be more forward in Nigeria. They're more talkative and less likely to be quiet and just let something pass by. Oh no, I don't think so. Squirrel, right? So yeah, and then they tend to fidget a lot and squirm a lot and squirmish a lot. Not getting along with others, I think I want to say that again, because what's happening is people will tend to, I guess the children, let's start with children, they don't want to call you to play on their team because they think, oh, maybe you're going to, I don't know, for whatever reason, they might ostracize you. They might not want to play with you because, you just think that you're just so, I use the word obnoxious because kids use that a lot, obnoxious. But really, that's who they are. And I think the beauty of ADHD is, of course, it's a spectrum. It can be mild, it can be moderate, it can be severe. But I think the beauty is we're in 2020 pretty much now. You can't remain in that mindset of, I'm not going to talk about it. I don't want people to know about it. I can't help you if I don't know what's going on with you. I mean, I keep saying this. This is why we do these things. We talk about it because I can't help you if I don't know what's going on with you. So I need to make the diagnosis. You need to allow me make the diagnosis. And then I can help. I can give you the treatment options, and then you take them or not. But for your kid's sake, for your child's sake, I think as a pediatrician, I want to say to you, if your kid has any of those symptoms, holler at me, call your pediatrician, call your psychologist, call your psychiatrist, call someone. There is help, there's treatment. We cannot remain in that mindset anymore. Okay, so what to do? See your doc. Now, that being said, a lot of other symptoms can mimic, is the word I was looking for, mimic as ADHD. One of them is hearing disorder. Like if you have a hearing disability, because I said something about daydreaming, they almost look like they're in a different world, or you're calling them and they can't hear you. Yeah, what? They can't hear you? Something like that. Or you're like, I've been calling you, but they're daydreaming. That can mimic, hearing loss can mimic as that. So you need to see your doctor because we need to go through all of these other things that it could be. Sherry said because they're not aware of the impact of their actions on the kids. Yes, that is so true. Oh my God, high five, girl. Boom. But yeah, exactly. So you have to see your doctor. We got to check and make sure that, is it a learning disability for real? Is a child not acquiring new skills? Are they not able to learn stuff because they have ADHD or because they have a learning disability, maybe dyslexia, or because they can't hear you very well? Maybe they're full of wax. Maybe they have a hearing, like real hearing loss. Or they may be visually impaired. Anything that can truly, honestly cause a child to not be able to pay attention can mimic as ADHD. So of course, knuckles, sister. So yeah, and then the other thing that can mimic as that is thyroid disease. I say that and I take a deep breath because if I tell you how many people think that they have thyroid disease that come and see me that don't have thyroid disease, and yet when they have it and I tell them, then they're like, oh my God, I have it. Why do I say that hyperthyroidism, hyperthyroidism gives you so much energy. You're like just constantly bouncing off the walls. Of course, you have other things like proptosis and all that. But before it gets to that stage, you can be really, really hyperactive. Now, hypo, on the other end, that the low thyroid hormones can give you no energy and you're just like not paying attention. You're lethargic all the time. So again, they can mimic. So I do beg you and implore you, which is why I do these things, to just take your child to the doctor, have a conversation. I light the spark to allow you to talk about it. And then maybe it's not, or maybe it is. Okay? Then I know you guys want to know what is the test. Well, there's no test. There's no actual ADHD test. Here, come, let me draw your blood for this or that. But if you live in an old house that has lead paint and your child gets in the lead and may have lead poisoning, that can present with ADHD, with hyperactivity and learning disabilities. So you see why you need to talk to your doctor? Kind of just start talking. Stephanie says, once I acknowledged something wasn't right and got him diagnosed, life has been much better, in capital letters. Oh my God, Stephanie, I love you. And Stephanie was the one who asked me to do this talk. So you see, she acknowledged and accepted. Because one thing that we do in the Black community, I know for a fact, I'm going to say it, is we just go to church and then we're like, oh, it's not my portion. Oh, God is this and God is that. Let me tell you what God is. God gives you the knowledge between right and wrong. 1, 2, God gives you the resources in the forms of doctors and psychologists. So don't tell me God is going to take it, or it's not my portion, when you're not engaging with the medical community and knowing, okay, what is it that God is going to help you take? You know that story about the guy who was trying to get a job and was like, God, give me a job, give me a job, give me a job. And God said, dude, apply. You need to go and see the doctor first. Then maybe, just maybe, we'll make the diagnosis. So go to church, pray. I don't have anything wrong with that, but just when they do tell you what's going on, accept it. And then take the necessary steps. And that's God talking. That's God working. In the Black community, we are so into this thing. It doesn't make any sense. Like, oh my God, don't let them put your child on medication, or don't, whatever. Really? Like, seriously? I'm never going to go there. There's one thing, though, that we do. It's called a Vanderbilt or Connors. It's a rating scale. So it's a piece of paper, or like, I guess, a folder, almost a booklet, for lack of a better word, that you can, your doctor is going to give that to you, and you're going to check off some of the questions, the symptoms that I just went through now. Is a child, does he act like he's driven by a moto? Does he act like he's daydreaming all the time? Depending on the answers you give to the questions, if you answer 6 or more, is a scoring sheet. So if you score 2 or 3 on 6 or more of, and I wish I thought about it, I would have brought a sample so I can go over the questions. But essentially, the stuff that we talked about, then maybe the child has either more hyperactive type, or more impulsive type, or more inattentive type. And also there are questions on those rating scales that ask you questions to relate to, do they have anxiety? Are they antisocial? Are they also, other things like personality disorder? Because like I said, it's a psychiatric diagnosis, psychological, psychiatric diagnosis, and you can have other things that can mimic it. And a lot of times, a child who has ADHD, who is completely misunderstood, what else are they going to do? They're going to be frustrated a lot, right? And they might even act out a little bit. And so they might get frustrated and they might act out. And then you now say, oh yes, I knew it. I knew it wasn't ADHD. You know what I mean? Like, one thing I say is, which comes first? You tell your little son, Johnny, we're going to a party, right? This afternoon. And you forget that the thought of going to a party for any child is exciting. And so before the age of 12, you get kids that are normal, that have symptoms suggestive of, I use the word suggestive of ADHD, right? So you tell little Johnny, we're going to a party today at 4. And little Johnny is excited, naturally. Or little Sissy, Peaches, whatever. And then you get to the party, and then she takes a piece of cake. And then she's jumping. What do? You blame it on the cake, right? Oh, it's the sugar. No, it's not the sugar. If you think back, before she got to the party, she was already excited. It is a natural progression. And people come and say, no, Dr. Ome, it's the sugar. And it's not the sugar. Sometimes. It's not the sugar. Sometimes it's the thought of that activity that makes them happy already, pre-happy. And then of course you give me cake, I'm gonna be happy. But I'm giving an example. I hope you guys understand that. I'm just trying to say that it's not always like this causes this. Sometimes it's a soft fluidy thing. It's not that concrete. I hope that made sense. Okay, so let me see. So yeah, those numbers are real. And going back a little bit to what I was saying earlier on, I want to stress that there's no single test. So don't go to your doctor and say, Dr. Lulu said that there's a test. No, there's a questionnaire, if you want to call it that. Some kind of booklet that you have to check off some questions, and those questions will tell you, based on the answers you give, your doctor will now know, okay, ma'am, your son does not have ADHD. There's no way this kid who is scoring only ones and zeros has ADHD, because I get that too. Some kids come, they say the teacher says that the child has ADHD. One example is one of my patients who, when I was in Lancaster, he used to make paper. I think no, his teacher always complained that he had ADHD. That he was disrupting the class. Yeah, that's what it was. And actually, I forgot to mention this at the beginning, but most people that have ADHD, it's okay as long as it doesn't affect their learning, affect the home, causes stress. Like he's not affecting other kids, like distracting other kids, things like that. So this little guy used to disrupt the class a lot, and his mom refused to believe that he had ADHD, that he had anything wrong with him. So she went to school. I told her, I said, you know what, why don't you sneak up to the class and check? I was in Heat Springs then. I said, why don't you just go and see if maybe he really does. Just sneak up to the class and just watch him and see if maybe this teacher is making up stuff, right? So do you know what she did? She snuck up to the class and she came back and said, Dr. Ume, my son was doing cartwheels in the classroom and making paper planes and shooting people with the little paper things that you shoot with a rubber band. And she was like, she could not believe it, that he doesn't really do that at home. But is it that he doesn't do it at home, or because he's an only child at home, she's used to him doing that? But when you put him in a classroom with 30 kids, what do you want him to do? So anyway, we took care of that, but that was a funny story from my past, and I just thought I should mention that. So when the teacher tells you that your child is disrupting the class, sometimes it's true. Remember what I say all the time, the teacher is an extension of the parent. They are your eyes and your ears at school. So 9 times out of 10, they're not making this stuff. They're not just trying to get your kid in trouble. I know there's some crazies out there, but most of them really want to help. So I'm going to say, if the teacher says that your child has issues, believe them and bring them to the doctor or the psychologist, and let's talk about it first before we say he doesn't really have or she doesn't really have. I keep saying he because I have boys. Okay, so indeed, you may want to ask me, so Dr. May, where does this ADHD come from, right? Well, there is a genetic, yes, it's actually like a genome. It's been mapped on the human gene, a transferable gene. You know, in the old days, you take the needle and put it on from the whatever and put it on the record. There's a gene that transfers from parent to child. If the parent has ADHD, more than 50% of the time, actually 50 to 75% of the time, maybe even 80 in some cases, they're going to transfer to their kids. Yes. I lucked out, I think, because my ex-husband was just like this. So generally, he's like more mellow or whatever. So I think two of my 3 kids are more, even my baby is still relatively mellow. I think I have all the energy. But he's got a little bit, but not too much. But I just flying solo. Yeah, but yeah, 50% of the time for each birth, right? There's a 50% chance of transferring it, or more than 50% chance of transferring it. But of course, there are 2 people that it takes to make a kid. So if the other gene blocks it, then maybe it won't happen. But there is that tendency to go from parent to child. Why am I saying this? Because if you're a parent and you're watching me and you have ADHD, please don't be surprised if your kid gets ADHD. You know, it makes sense that your kid will get ADHD. So anyway, I wanted to mention that. Let me see what else. Yeah, that's about it for this page. I think let me mention this, that they're in the frontal lobe of the brain, there's some dopaminergic receptors, and there's imbalance, a chemical imbalance, let me put it that way, on the dopaminergic receptors in the frontal part of your brain. And the frontal cortex is the part of your brain that is in charge of organization, cognitive behavior, all of that. So it makes sense that if there's something going on with your frontal or your precortex, your frontal brain, then it's possible that your child, these are the symptoms that the child is going to present with. And that's why the medication also tries to fix that. So we'll talk about that later on. I think that's all I had on this page. Long-term things that can happen long-term, and I wanted to mention here, I'm going to talk about long-term in a minute, but most children who have ADHD, as long as the symptoms occur before the age of 12, that's a new, it used to be 7, but now it's 12, then, think ADHD before the age of 12, okay? So even your 11-year-old can be diagnosed, your 12-year-old can be diagnosed, but it becomes adult ADHD if a child presents or continues past the age of 17. So I know it's kind of confusing. Okay, so childhood ADHD, 12 and under for sure. So between 12 and 17 is kind of like a gray zone. But if those symptoms persist until past the age of 17, then it's adult ADHD. Okay, so that means it didn't get better. Now, usually like I said, with adult ADHD, most of the hyperactivity tends to be less at this point, and the impulsivity tends to be less, not all the time. But the inattention and the forgetfulness and all that still tend to persist into adulthood. Okay, so that's that for that. Treatments. No, I think I was going to do long-term. So long-term, what are the long-term complications? Now, we've mentioned all these movie stars. So we know that long-term, it could be nothing. Look at me, shining, right? So long-term, it could be nothing if you know how to harness your energy. I love to exercise. So I use up my energy exercising. If you know what is good, what you can put your energy into, put your energy into it. ADHD-wise, okay? Just do that, and that's okay. But what about if you don't? What about the kids who have true ADHD and don't get treated, or their energy doesn't kind of get channeled correctly? Yes, those are the ones that get in trouble. Those are the ones that they miss school a lot and eventually kind of drop out of school. And I don't like that aspect, because the truth is, it is treatable. They should not be dropping out of school at all. It's almost 100% treatable. So your child has something that's treatable. Imagine if it was asthma. Imagine if it was, God forbid, sickle cell or diabetes. Treatable. Would you not treat? Of course you would. So it is treatable. So why should a child be missing school? Why should a child have any reason to fail grades? You understand what I'm saying, right? So I'm not going to beat that horse too much. But indeed, long-term untreated ADHD, they become truants. I mean, the truth is, everybody's picking on them every day. They're disrupting the class. Go to the principal, go to the principal, go to the principal every day. Detention every day. ISS every day. What do you want the kid to do? I mean, eventually they're going to be like, you know what? Peace out. And then they drop out of school. And then, of course, they join that company. And then before you know it, whatever. So, there. And then, for ADHD that persists into the severe ones that persist into adulthood, they can have relationship problems. And if your wife doesn't understand why you're always on the go, oh my God, My wife swears that she has ADHD, but I think she has ADD because she's very, very mellow. But according to her, she can't focus. And that is true. She's always watching TV to stay focused. So, I mean, I guess, it just depends. Or maybe we all have ADHD. Maybe we should all just check ourselves. I think there's an online test. I think there's an online downloadable PDF that you can actually download and just kind of go over the questionnaire and just see if you have it. Of course, failed grades leads to drop out of school and then of relationship issues. And of course, if you feel down enough, you can have substance abuse issues. Okay, and that's another bad thing. We don't want that. So substance abuse can be a problem with failed treatment, or rather untreated ADHD. Decreased earning potential, because they're not able to either get a job and or hold a job. They're making so many mistakes like we talked about at the beginning. They're careless. They're losing things. They get fired a lot. So decreased earning potential, which really kind of ends up in maybe depression, right? And then suicide, right? So now you get the connection. So we don't want to do that. We don't want to do that. A lot of problems at work, problems at home, problems everywhere. And if you tell a kid long enough that they are bad, what happens? Yeah, so is ADHD treatable? Abso-freaking-lutely, it is treatable. And yes, it's medication. But I like to use the word not treatable, more like manageable. And I use the word manage because I don't want to just take the one child and just treat this little bottle. This bottle is a member of this family, right? So what I'm going to do is manage the disease process in the family and get everybody in the family engaged and involved in the treatment. That's what I call management. I'll tell your parents what time it is. Tell your parents what's going on so that if they understand their child, that's half of the war is already won, right? Tell your wife what's going on. Tell your kids what's going on. If everybody knows, okay, daddy has ADHD, then maybe you wouldn't put the house in a crazy environment where you already know that this kid is already like going to be really, really hyper. You know, something like that. I was going to say something else. I forgot what it is, but just something like that. So I want the whole family to know what's going on with their child, and then we can all together manage this problem. Not just here, take your pill. You know, no, it's like, you know, the mother has to know what's going on. The school has to know what's going on. As a matter of fact, part of the diagnosis is we get the teachers to also fill out that form. Because one thing about ADHD is it tends to be present in 2 or more places. And that's a good thing, actually. I'm glad I remember that, because what happens is 2 or more places means it's, if you give me a child who only has that problem in school, as an example, these symptoms only occur in school, not at home, not at the YMCA, not at church. What am I saying? Maybe somebody is bullying him at school. Maybe the teacher is picking on the child. Maybe other kids are, you know what I mean? Like, it's impossible to have ADHD only in one place, only at grandma's house all the time. So I'm glad I thought about that, right? So yeah, it has to be present in 2 or more locations where the child, situation where the child, like on the school bus, this is his behavior. At home, this is his behavior. At school, this is his behavior. At church, everything is consistent, not just only at school. Maybe because he's acting out because he's being picked on at school, which is not ADHD. That's bullying. Does that make sense? And so yeah, that's one thing. I'm so glad I thought about that. Okay. Let me see what else. Yeah. So treatment. As far as treatment goes, yes, I'm not going to talk about that in detail because this is not a medical consult. I'm not giving you medical advice. I'm just talking. So just know that there's treatment for it. There's stimulants and there are non-stimulants. And we can usually figure out what's going on with the child and then know exactly how we can come in with medication. And no, you might not get the right dose the first time. That's one thing I tell the parents all the time. I have to do what we call it stepwise. So we kind of try the lowest dose ever. If that doesn't work, then we try the next step. And the next and the next. And I usually give about a month to 2 to 3, even sometimes 3 months before we can find the dose and even the kind of medicine that works for the child. Because in other words, I'm just going to, here, you look like a 5 milligrams kind of kid. Here, take this. No, I don't know that, but I can start you at 5 and then you come back in a couple of weeks and tell me how he's doing. And I've had parents cry in the office like, oh my God, he's so different. I just wish I had started it sooner. It's okay. Better late than never. So please do the right thing when your kid is concerned. Do you have any questions? Let me see. You look amazing. Thank you, Chris. I have a lot of people in the building today. Thank you guys for joining in. Maybe because it's ADHD. Okay, no questions. Somebody said they lost me. Oh, God. Oh, I don't know. Anyway, let me see. Any questions, people? Cheryl said some parents figure out they have ADHD when they're kids. Yes, that is so true. And I call that retrograde diagnosis. I diagnosed a lot of my parents after I diagnosed their kids. That is so true. Thank you to Sherry. That is so true. That is so true. I forgot about that. Let me see. Any questions? If we don't have any questions, that's about it. That's all I have for you guys today. I just had one more thing to mention. My ebook is out. Yay! So, before you get too excited, it's not the one book that you guys voted for me. That's the big one. This is my ebook. The one I've been talking about that I was going to try to kind of like pre-release. It's called How to Raise Well-Rounded Children. It is out. Yay! It's on Kindle if you're a Kindle user. I'm still trying to get it on my website. It's going to be $6.99 on my website. For now on Kindle it's $9.99, but go get it. Go get it, everyone. Go get it. Yes, I'm excited. Go get the book on Kindle today. Let me know how it is. Please, it's like 50 pages. It's not even anything. It's How to Raise Well-Rounded Children. You want to know this about how to raise your kids. You want to know this. So please, my book is out. Estoy muy contenta. I'm so excited. Thanks. Thank you so much. So yeah, my book is out. I'm so excited. Go get it. Okay, it's only $9.99. It's less than, I don't know what. It's cheap. So go get it. And the second, it's book 1 of 6 books that I've been telling you guys about. This is book 1. It's How to Raise Well-Rounded Children. It is there. Go get it and read and then let me know how it is. Okay. Second thing is I'm having a program here in San Antonio in about a couple of months. Oh, well, next month, actually, in March. Oh, wow. It's going to be kind of sort of based on the book. It's going to be Dr. Lulu's PYT is what I'm calling it, Dr. Lulu's Parenting Your Teen Workshop. So if you live in San Antonio, stay tuned. We're going to talk some more about it. Oh, thank you so much, Felicia. She said I look beautiful. I appreciate it. Stephanie says thank you. Thank you. You're welcome. You're welcome. That's why I do this. So keep your questions coming. Inbox me your concerns. Anything you want to hear about pediatrics, just let me know. I'm here for you guys. I'm here to serve you. But other than that, just go get the book. It's on Kindle. My name is Dr. Uche Naomi, of course. So type in my name or type in the name of the book is How to Raise Well-Rounded Children, and go get a copy, and we'll talk about it again next Sunday. So because February is National Teen, I want to call it Teen Dating Violence Month or something. I can't phrase it correctly. Hi, Josh. I can't phrase it correctly. Next week, I'm going to let you guys, let me talk about dating violence. I'm going to figure out how to say it correctly next week Sunday. And that's not Valentine's, right? No, okay, I'll do it on Valentine's Sunday. Okay, never mind. I'll do it on Valentine's Sunday. But February is National Teen Dating Violence. That's the word. National Teen Dating Violence Month. So I'm going to talk about it because I had a patient's mom request it a while back, but I was going to just wait until February. So we're in February now, so I'm going to do that. Otherwise, next week, I don't know what we're going to talk about. Stay tuned. Something. By the way, if you live in San Antonio, if you seen my Facebook, maybe a couple of hours ago, I put a post. There's a 17-year-old boy that's missing. Please, this could be my son. Please go to my page and share. Somebody knows where that boy is before it's too late. I don't want to be talking about him next Sunday. So please, if you're watching this right now, there's a 17-year-old boy missing. He's on my page. Please go share widely. Let's find our son, okay? I don't know where he is, but he might as well be mine, and it could be mine. So please, let's find our kid. If you live in San Antonio, check it out, okay? Other than that, I'll see you all next Sunday. Send me your questions, send me your concerns, and I'll see you next time on Ask Dr. Lulu. Peace out.